get the care they need. Too many people are suffering from your corporate greed.
We have a $2.5 trillion factory, and if you look inside this factory, you see a lot of economic entities, clinics, hospitals, drug companies, insurance companies, medical supply companies, lots of lawyers and doctors. And inside this factory, the way to make the most profits is to treat somebody that's very sick with a lot of technology and make them a little better or keep them from dying. You don't make much money in this healthcare non-system keeping you healthy or keeping people with chronic diseases from stumbling into the ranks of the ill. So the magic of the marketplace is that we have a lot of sick people to take care of.
Stories must be told, how lives were sold.
I pay $1,206 a month for my medical insurance. I am uninsurable because of breast cancer. Was on a COBRA, ran out of the COBRA, had to go on to the state high-risk program. It went from $900 to $1,206 in January. If it goes up again, we're going to be in a bit of trouble.
This is our anti-war. This is our civil rights. Our generation needs to stand up because behind all of this policy and behind all of these agreements and disagreements is real human suffering.
No, you can't run and hide from this rising tide.
I would love to have us have a single-payer system because I think that's the only one that would sufficiently conserve our financial resources to make it possible for everybody to get care.
When you get sick in this country, the system just destroys so much of our pride and so much of who we are.
This is the United States of America. Let's get some morality.
They get to cover the healthy and the wealthy, and then they dump the poor and the sick on the government.
Just coming to my senses here. We passed Ames and now we're in Story.
Story. It feels like we're in a story.
It used to be the poor who couldn't afford health care. Now, not only is health care the #1 cause of bankruptcy in this country, as you know, it's caused more bankruptcies than every other cause combined. And the people who are going bankrupt aren't the poor. It's people who have health insurance.
Our country ranks 37th in healthcare outcomes. And we here, we're #1, 37th.
The insurance companies have divided us and conquered us. They turned us into left and right, conservatives and liberals. This is not an issue about politics. This is about human lives.
They make the laws, they buy the lawmakers, the judges, and they surround themselves with the protection they need. And if you play their game, it's always going to be their game.
President Obama knows that what's being proposed is not going to fix it. Unfortunately, he's buying into the rhetoric that health care reform is the litmus test for his success as a president. I feel really badly for him. He's in a real pickle. And I want him to succeed, but I don't want us to have health reform that isn't. I think he thought that with the Democratic Congress he could accomplish something. I think he's finding that the industry is just way too powerful.
What do we want? Health care! When do we want it? Now! What do we want?
I've worked 25 years and in a company, and I should not have to risk one of my kids or me getting sick and go bankrupt when health care should be a human right and not a privilege.
A right defined in the Universal Declaration of Human Rights, a right defined in our Constitution and our Declaration of Independence.
We have politicians that are supposed to represent us that are practicing un-American activities.
They're putting their lifestyles and their livelihoods and their political career in front of we, the American people.
This is a national security issue. Every year, 45,000 people die prematurely because they don't have health care.
We are in a war. We're in a war to restore America's integrity and soul.
We're standing in front of Humana right now. This this huge edifice in front of us that looks like it cost an awful lot of money, and you know where that money came from.
We're marching from Indiana over to Louisville across the 2nd Street Bridge. It's a memorial march for the uninsured, you know, for all the people that have suffered because of our terrible health care system. Some have died. It's a real tragedy.
And none of my children can afford insurance. And they're being responsible, not having babies because they don't have insurance. So I'm mad as hell because I'd like to become a grandmother.
Now, what we are seeing on this tour as we went across the country is appalling. It's much worse than I ever thought. 86% of Canadians approve of their health care. Why don't they? The VA system is a single payer funded by the public. It has 83% of the veterans approve the care in the VA, and it has the highest quality assurance of any hospital system in the country. Why don't they? T.R. Reid, in his book, has shown that there's 5 countries that have a public system, everybody in, nobody out, for half the cost, and it works. Why don't they? That's what I say. Why don't they just tell us the truth?
When I first felt sick, I hid it from my family and my husband. And I thought I'll just go on until I think I'm going to die, because if I knew it was something bad. And then go in and I'll die fairly quickly and we won't lose the house.
And I'm mad as hell because when I found out I had breast cancer last December, I was scared for a minute about dying, but what I really was scared about was how I was going to pay for it. And the fact that my friends held fundraisers to make money so that I would be able to pay my co-payments.
I'd like you to hold up your hand with one finger raised, the index finger. On my honor, as a healthcare advocate, I will do all that I can to create here's the definition, a system of payment that redirects all current healthcare monies, both public and private, into a single public fund that covers everyone until death do us part.